Welcome to NSG 227, Study Session 6, Catheterization 2. Introduction. This teaching session is a continuation of the previous session. It will expose you to the different types of catheter and the various methods, contraindications, and complications of catheterization. Learning outcomes. When you have studied this session, you should be able to 1. State the various types of catheter. 2. Present the methods of catheterization. 3. State the complications of catheterization. 4. Point out the contraindications of catheterization. Types of catheter. These are 1. Intermittent catheter, where the catheter is temporarily inserted into the bladder and removed once the bladder is empty. It drains the bladder for short periods, 5 to 10 minutes. 2. Indwelling catheter, where the catheter remains in place for many days or weeks and is held in position by a water-filled balloon in the bladder. It is placed into the bladder and secured there for a period. 3. Suprapubic catheter. This type of catheter is inserted into the bladder through a small incision above the pubic area. It is used for continuous drainage. 4. External condom catheter. Catheter sizes. The French scale is used to denote the size of catheters. The smaller the number, the smaller the catheter. A larger size catheter is used for a male because it is stiffer, thus easier to push the distance of the male urethra. A. Number 8 FR and 10 FR are used for children. B. Number 14 FR and 16 FR are used for female adults. C. Number 20 FR and 22 FR are usually used for male adults. 1. Straight catheter. 2. Coiled catheter. 3. Three-way catheter. Methods of catheterization. These are short-term catheterization. Indications are 1. Obstruction. Catheter will be fitted until the underlying condition can be treated. 2. Surgery on the womb or ovaries and procedures involving the large bowel. 3. During childbirth, to drain the woman's bladder. 4. Blood clots and debris following an injury to the bladder or surgery. Long-term catheterization. Long-term catheterization may be needed if it is not possible to treat the underlying condition that prevents the bladder from emptying naturally. Indications are 1. Very ill patients. 2. Urinary incontinence. 3. Inability to empty the bladder or nerve damage, neuropathic bladder. Note: the alternatives to urethral catheterization include suprapubic catheterization and external condom catheters for longer durations. Female catheterization. Implementation, nursing action, and rationale. 1. Explain the procedure to the client and the purpose of the procedure. By understanding the necessity of the procedure, the client becomes more cooperative. 2. Pull curtains around the bedside and close the curtain. Provide privacy for the client. 3. Door to the room. Prepares efficiently for the procedure. 4. Bring necessary equipment to the client's bedside. It deters the spread of microorganisms. 5. Wash hands thoroughly. Places the client in the optimal position for exposing the perineum. 6. Position the client with knees flexed and legs laterally rotated or seams position. Minimizes exposure of the body and provides warmth. 7. Drape the client with a bed blanket or sheet. Enables visualization of the urinary meatus. 8. So that only the perineum is exposed. It protects the bed from soiling. 9. Position light source directly on the exposed. Prepares equipment for later use. 10. Open the sterile catheterization pack on the tray using sterile techniques. Placement of equipment on the working area increases efficiency. Sterile technique protects the client and prevents spread of microorganisms. 11. Put on sterile gloves. Grasp the upper corners of drape and unfold without touching the unsterile areas. Ask the client to lift up her buttocks and slide the sterile drape under her with gloves protected by cuff. The drape provides a sterile field close to the meatus. 12. The drape with its center is placed over the perineal area, exposing the labia. The drape expands the sterile field and protects against contamination. It is optional. 13. Place the sterile tray on the tray between the client's thighs. This provides easy access to supplies. 14. If the catheter is to be indwelling, test the catheter balloon by connecting the syringe to the balloon port and insert the correct amount of fluid, inflating the balloon. A balloon that does not inflate or that leaks needs to be replaced before insertion into the client. 15. If the balloon inflates properly, deflate it by removing fluid. Leave the syringe attached to the port. It prepares for the procedure while both hands are sterile. 16. Lubricate the tip of the catheter about 1 to 2 inches. Place drainage end of catheter in the collecting basin. Provides for ease of insertion of the catheter and reduces trauma to the tissues. 17. With the thumb and one finger of your non-dominant hand, spread the labia and identify the meatus. Be prepared to maintain separation until the flow of urine is continuous. Leave the non-dominant hand in this position. It is contaminated. This will expose the meatus. Removal of the hand may enhance the possibility of contamination of the sterile area later. 18. Using cotton balls held with forceps, clean both labial folds and directly over the meatus. Move the cotton balls from the anterior of the perineum to the posterior, that is, from above towards the rectum. Discard each cotton ball after each downward stroke. Cleansing the mucous membranes with an antiseptic lotion reduces the number of microorganisms and contamination. Forceps reduce the possibility of contamination of gloves. Cleaning the meatus last helps reduce the possibility of introducing organisms into the bladder. 19. Ask the client to take a deep breath and release it slowly as you begin insertion. Relaxes perineal musculature. 20. Insert the catheter tip into the meatus 5 to 7.5 centimeters or until urine flows. Do not use force to push the catheter through the urethra. If an indwelling catheter, insert for another inch. Eases the catheter insertion. Female urethra is about 3.7 to 6.2 centimeters long. Urine returns demonstrate that catheter is properly positioned. Further insertion ensures that balloon is well inside the bladder and not in the urethra. 21. Hold the catheter securely with the non-dominant hand while the bladder empties. Collect a specimen if required. Withdrawing and reinserting the catheter increases the possibility of contamination. In general, not more than 750 ml of urine should be removed at once to prevent hypotension. 22. Remove the catheter smoothly and slowly if a straight catheterization was ordered. This causes less discomfort to the client. 23. Grasp the syringe connected to the balloon. Port and inflate according to the manufacturer's recommendations with H2O or air. This inflates the balloon, prevents the catheter from slipping out of the bladder. Balloon size is usually stated on or near ports. 24. Tug gently on the catheter after inflation to feel resistance. This tests the position of the catheter in the bladder and determines the inflation of the balloon. 25. Secure the catheter to the upper thigh with a tape. Leave some slack in the catheter to allow for leg movement. Prevent catheter from pulling on the urethra as the client moves. 26. Check that the drainage tubing is not kinked. Attach the collecting bag on the side of the bed, keeping the bag at or below the bladder level. This facilitates drainage of urine and prevents the backflow of urine. 27. Remove the equipment and make the client comfortable in bed. Clean and dry the perineal area if necessary. Send the urine specimen to the laboratory promptly or refrigerate it. 28 and 29. Wash your hands. Remove and discard gloves. Male catheterization. Implementation. Equipment and as for female catheterization. Nursing action. Rationale. 1. Assemble the equipment and follow 1 to 4 for female catheterization. Exposes the glands and urethra for effective cleansing. 2. Position the client on his back with the thighs slightly apart. Cleaning the area around the meatus and under the foreskin in the uncircumcised male client helps prevent infection. Moving from the meatus towards the base of the penis prevents bringing organisms to the meatus. 3. Drape the client's upper body with a bed blanket and cover the lower body with the bed sheet so that only the genital area is exposed. Straightens the urethra and allows for ease of insertion. 4. Follow action 7 to 15 for female catheterization. This provides easy handling and ensures that the balloon is in the bladder. Not forcing also prevents irritation or trauma to urethral mucosa. 5. Generously lubricate the tip of the catheter for about 15 to 18 cm and place the drainage end in the collecting basin. Resistance may indicate stricture of the urethra or prostatic enlargement obstructing the passage. 6. Lift or grasp the penis firmly with your non-dominant hand, which is then considered contaminated. Exposes the glands and urethra for effective cleansing. 7. Retract the foreskin in the uncircumcised male client with the thumb and forefinger and spread the meatus open. Cleaning the area around the meatus and under the foreskin in the uncircumcised male client helps prevent infection. Moving from the meatus towards the base of the penis prevents bringing organisms to the meatus. 8. Pick up a cotton ball with the forceps and using a circular motion, gently cleanse from the meatus towards the base of the penis. Straightens the urethra and allows for ease of insertion. 9. Hold the penis at a 900 angle from the body and gently pull upward. This provides easy handling and ensures that the balloon is in the bladder. Not forcing also prevents irritation or trauma to urethral mucosa. 10. Pick up the catheter and gently insert it into the urethra for 15 to 20 cm or until urine flows. Insert another inch. If resistance occurs, have the client take a deep breath or bear down as if voiding. Changing the angle of the penis may also open the urethra. If resistance continues, do not force insertion, but remove the catheter and inform nurse in charge. Resistance may indicate stricture of the urethra or prostatic enlargement obstructing the passage. 11. Follow action 21 to 29 for female catheterization, except that the catheter may be secured to the upper thigh or lower abdomen with penis directed towards the client's chest. Slack should be left in the catheter to prevent tension. This is done to prevent irritation at the angle of the penis or scrotum. Slack left in the catheter allows for penile erection, which can occur naturally during sleep. Communication. 1. Observation. Throughout the procedure, observe the client for pain, bleeding at the meatus, or obstruction in the passage of the catheter. 2. Documentation. The time of catheter insertion, the amount of sterile water used in inflating the balloon, presence or absence of bleeding or inflammation. Note the amount, color, odor of the urine. Complications or harmful effects of catheterization. These are 1. Infections such as urethritis, cystitis, pyelonephritis, and transient bacteremia. 2. Paraphimosis caused by failure to reduce the foreskin and catheterization. 3. Urethral strictures. 4. Urethral perforation. 5. Bleeding. 6. Altered micturition. The contraindications of catheterization. Urethral trauma. Study session summary. In this study session, you learned about the different types of catheter and the various methods, contraindications, and complications of catheterization. End of study session 6. Thanks for listening.